I'm a middle-aged German dentist who enjoys sauerkraut and yodeling.
And I'm a groovy 60s news anchor.
Put down the schnauzer.
And put down the tie-dye.
It's time for the Halloween edition of Chairside Live. Welcome into our spooktacular episode of Chairside, nay, Scareside Live. Megan, you look far out. How are you doing today?
Groovy, how are you? I see you're dressed as a German.
I am. I'm a German waiter. I'm doing a double shift at the Hofbrauhaus, flying over there as soon as I get off here today.
Nice. Well, do you know any German?
I do know a little German, and he's right over there. All right, well, we've got a very scary case of the week to keep with our Halloween theme that we'll get to a little bit later today on an impression that a doctor sent us for a Bruxer crown. But before we do that, let's go to our viewer mail. This week's viewer mail comes to us from a viewer named Ben, who left a comment on Chairside Live episode 22 on YouTube. And he goes by the name Brush 3000. I like that. I love when dentists have little dental nicknames. He says, great series of programs. The case of the week is the highlight. Keep up the good work, Ben. Well, Ben, thank you so much. I've got a small, really the case of the week is the highlight?
I would beg to differ.
I feel like it's either my witty comments that I make after the news story or the close-ups on Megan's face, especially this week with the go-go outfit. But Ben, if you like the case of the week, I appreciate hearing that, but I think I think what you're saying, if I'm hearing you correctly, is that's the best part and everything else is very closely tied for second place. So as a result, Ben, of you leaving that nice comment for us, you're going to get one of the rare copies of the signed Mike and Megan photo like we sent out last week. And soon, viewers, we're going to have our own Chairside Live coffee mugs that you will see, and we will sign those and send those out to you as well. Feel free to trade those with your friends and or sell them on eBay. All right, now let's go ahead and go to Megan and the news.
Vampire wannabes and Hollywood enthusiasts rejoice. Mountain View Family Dentistry in Arizona is making custom fangs for patients for limited time only. But they're not just for Halloween lovers. The fangs are also attracting fans of the upcoming premiere of Breaking Dawn, the second part of the final installment of the Twilight movies. The cost of the fangs is a $50 donation to Sharing Down Syndrome, a group that helps families with Down syndrome children. The fangs are available until November 16th, the day the movie is released.
Well, I don't know if our lab had anything to do with that Breaking Wind movie that you mentioned, but I do know that, I don't know if you knew this, but we actually here at Glidewell Laboratory in the Biotemps department made the teeth for Tom Cruise in Interview with a Vampire.
So cool.
And so we started doing this, and there's several people. We did the teeth for Mrs. Doubtfire, and there's other movies that we have done this for. So this is something that we did, and I don't think too many other people did it before. So it's neat to see the dental office getting involved like that and doing it for part of charity and stuff like that as well. But if you want a set of these, I'll see if I can get you one made for next episode.
Let's do
Very
that.
good. Anything else?
Yes. Does the thought of Halloween candy rotting the teeth of American children keep you up at night? If so, you should participate in the Halloween Candy Buyback. This awesome nationwide program allows dentists to buy back candy that kids collected from trick-or-treating with cash, coupons, toothbrushes, or other creative goodies. The collected candy is then sent to Operation Gratitude or other military support groups that will send the candy to deployed U.S. military service members. You can register your practice in the program by signing up at www.halloweencandybuyback.com.
I think that's great. This is something that's been going on at dental offices for a long time on a more informal basis where certain dental offices would just decide to do this. And we actually did it for a couple of years too. And I don't want to cast any dispersions or give any bad news to Operation Gratitude. But let me tell you what usually happened, at least in my office and most of my friends' office. Kids bring in a bunch of candy and you clap a lot and you pat them on the back and you give them a free toothbrush or some other 99-cent toy made in China and you send them away, and then rather than take all this candy and send it to where you're supposed to send it, you have never seen anything like when you see a dental staff and the dentist, in my case, descend upon this pile of goodies. The Reese's peanut butter cups, gone in seconds. Fist fights breaking out over Baby Ruth's and whatever people's favorite candy bars happen to be. I can guarantee you that about 4% of the candy that gets turned into these offices is going to make it to Operation Gratitude. But that's better than nothing.
That's right, and what a good way to relieve the parents of the sugar high their kids will get, and then it goes to the troops, so it's a win-win.
4% goes to the troops.
Just listen.
The
okay?
rest is going to be the dental staff bouncing off the walls, going insane. But we have really good oral hygiene habits, and so we tend not to get any cavities. So it's safer for us to eat it, kids, and that's why I raid my kids' trick-or-treat bags before they have a chance to get the good stuff out of there. All right, thank you, Megan. Now let's go ahead and take a look at the case of the week. Since this case of the week is for the Halloween edition of Chairside Live, I wanted to share something with you that was kind of scary. And so what we've decided to share with you is a tiny denture that was made for a gremlin sent to the laboratory. And this devil-like creature had no upper teeth. And we were instructed by the dentist, the heathen dentist, to make a tiny, tiny denture for this Satan-like creature. And just to put it in perspective, here is a dime next to it. I miss those days. When I was growing up as a kid a lot, there was a lot of pictures of coins next to things to kind of show how big they were, but you don't see that much anymore. And the father of that tiny gremlin is a rapper. And here you see we've got basically a grill of sorts, but it actually hooks on and snaps on to the tiny gremlin's father's teeth and makes him look pretty intimidating. So now that I look at it, neither of those are really all that scary. So let me bring out something that's actually, I think, a little bit scarier than both of those cases, and that is this impression. And the doctor almost went with the Halloween theme for us. We've got orange and chartreuse. Orange and black would have been nice. I'm not sure they make a black impression material, but as we look at it, you'll begin to see some of the scary aspects of this impression. Not a lot of wash material that's in there, and first of all, we've got a big divot here. There's just a big hole in the middle of the impression here. You can tell there was either a lot of fluid or some air that was caught there. And as we flip it over, you can see the patient, half of this last tooth, half of this wisdom tooth, was actually biting down right onto the tray. And this is one of those cases, you've heard me say before how I'm not a big fan of these plastic trays because they bend a lot. That material is actually pretty stiff, and so we don't see a lot of flexure there. But anytime you're going to use a plastic impression tray, I really request that you use a nice stiff impression material like this. For a second, let's go back to the tray that I like to use, that Clinician's Choice tray. And this is that tray, the Quad Tray Extreme from Clinician's Choice. And you can see how wide it is back here. And this is really one of the things that I love about this tray. It's also the fact that you can't squeeze it and deform it. So you can pretty much use any impression material that you want to use. But really it's how wide it is back here that I like. And they're able to do that because it's a metal tray and not a plastic tray. And so for me, I have a much easier time being able to fit a patient's arch within that tray. You can see how much wider this tray is than the plastic tray underneath it. So when we're putting it in, we'll often rehearse. So we'll take this tray even before the impression material goes in. So the patient will have the cords packed and the copper cap on, and then we take out the copper cap and we'll try this tray in and have the patient bite down on it 2 or 3 times just to make sure it's not impinging and to make sure the patient's not biting down on any part of the tray. And so when they go to close into it the 4th time, when it's got the impression material in it, they do a much better job of closing into it, and we see a lot less of this where the patient's biting on the tray. And so we really do not have a very good bite here at all. We don't have any bite that we can use. We'll have to try to hand articulate it, but as you'll see, it's just not a great impression after we poured it up, and it's going to be difficult to hand articulate. In fact, if we look at the model here, you can see some of those bubbles and voids, and there's actually a little bubble that I haven't even popped there on the top of the stone yet. And so we get something like this and we look at it and we realize we probably aren't going to be able to use it. But just to the point of talking about the impression tray, if we put this tray over the arch, we can see how much room we have. So we have a lot more area to be able to move back and forth, buccal and lingually, and be off a little bit and still have the patient get together. Whereas on this impression tray, it's really, it's long. It comes so far forward and it's so narrow at the same time that you really have to fit it over that curved arch, and it makes it much more difficult to do. And if we look at, you can see here when we pour the opposing impression, of course, that this tooth is only half represented and then the patient was biting on the tray for the rest of that. And so as far as something scary to share with you, this is kind of a scary impression. Besides the fact just that it's orange, it's the fact that This was sent in, and a dentist was pretty sure that we were going to be able to make a crown for this. I mean, look at that void, that huge void on the distal lingual right there. So this is scary. It frightened one of our technical advisors, and she's now going to have to call the dentist and ask, pretty please, can we have a new impression? This just in, the doctor from the case of the week who took that scary impression, that was filmed a couple of days ago, and in the meantime the doctor took a new impression. Take a look, take a closer look at this impression. The doctor did an excellent job this time of capturing everything on the preparation, and the patient bit into the tray well. Kudos to you, doctor, for having the patient back in and doing the right thing and sending us this great impression. Well, that about wraps it up for this edition of Chairside Live. On behalf of myself, Megan, and everybody here at the laboratory, I want to thank you for your time and your continued commitment to quality dentistry.
Happy Halloween.
Gesundheit and Farfignuget.
Rolling.
I think I have a big head too.
Or it's just misshapen.
Okay.
Because the glasses are supposed to be big, but they fit you perfectly. The earrings. I'll give you $10 to wear the earrings for the rest of the day.
Oh gosh.
So that about wraps it up for this edition of Chairside Live. On behalf of all of us here at the lab, Megan and myself, I want to thank you for your time and your continued commitment to quality dentistry. Well, it was all wrong. The order was wrong.
Oh, okay.
The lab, Megan, me, my dog Jimmy.